This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson. Sarah Giossi has the week off, so you're stuck with me. So let me go ahead and apologize to our guest this morning. Dr. J. Fred Littles joining us, oncologist, radiation oncologist, joining us in studio this morning. Good morning, Dr. Littles.
Good morning. My pleasure.
I'm sorry you're stuck with me today.
Oh,
Sarah,
you're my guy.
Sarah decided she had to take a week of vacation. I don't know why. It's like she works hard around here or something. So
Vacations are important.
Are you ready for the holidays? I mean, they're here. It is Christmas time.
I am excited. I got a 2-year-old granddaughter in Atlanta, so I look forward to seeing her. And so she's excited about Christmas. So, we just follow the grandkids nowadays.
See, now you get to get the grandkids, all the stuff that mom and dad say, oh, no, you can't have that. That's where granddad steps in.
Yeah, well, I just remember my dad when he was with my daughters. I would say, who are you? And what did you do with my dad?
That's the fun of being a grandparent, though,
right?
Right.
So that's what I'm looking forward to. For my daughter to look at me and say, "Who are you? And what did you do with my dad?"
I remember growing up, I thought Santa Claus only brought 3 presents. That's it, everybody. Now, as I have nieces and nephews, my sisters have some kids. I'm looking at my parents, going, "What happened to this 3-present rule?" Again, hey, that's the fun of being the grandparent.
As I grew up, I had a lot of questions about Santa Claus. Number one, our chimney was too narrow for Santa Claus to come down. So I remember looking up the chimney one day. There was no fire in the chimney, but looking up the chimney one day and recognizing that it was too small for Santa. I just asked my mom, how does Santa come down through that chimney? And she said, oh, boy, I let him through the front door. And that answer was good enough for me because I knew I knew he wasn't coming down the chimney that I saw.
That's right.
Not as fat as he was. I think I was in the 1st or 2nd grade, but that was an important question for my mom to answer.
That's right.
Otherwise, she would have been lying to me.
Well, this is your second appearance on the show, right?
Yes.
Second time?
Yes. The first time was fun. Well, we make it better than the first time.
That's what we're going to try. Just remind people a little bit about your background before we get into today's subject. We're going to talk about low-dose CT scanning, but a little bit about your background.
Yes, I grew up in South Carolina. I trained in Metro Detroit, was with the University of Michigan for a decade. Been here in Morgantown for a little over 4 months now.
Are you enjoying it?
It's been wonderful. Very caring, highly educated, talented community that's, believe it or not, full of a lot of nice people. My wife was just getting a computer repaired at a local store and bonded with a retired police officer who has his own security business. And then she said, people are so nice here, Frederick. And, she had a nice conversation with him, retired police officer, and has his own security business just last night. So a very nice city, talented city, well-educated city, stereotypical university city. I mean, exactly what we had looked forward to, plus the smaller size, smaller than Ann Arbor, and a nicer group of people. So it's been a win-win-win scenario.
I always wonder, West Virginia, we claim to be some of the nicest people in the country, and I always wonder if that's just our claim or if it's actually true. So you're confirming that we are indeed some of the nicest folks you can run into.
I think being nice is a very great thing, but being nice to yourself is even better. And since we're talking about low-dose CT scan screening for lung cancer, one of the nicest things that you can do for yourself if you're a cigarette smoker is to quit smoking.
We talk about that. That's week in, week out on this program. That is one of the 3 things we talk about week in, week out. And we have a problem with that here in West Virginia.
Oh, my wife and I noticed that shortly after we got here. There's a lot of cigarette smokers here. So a nice community that basically needs to be nice to themselves.
Let's jump into that subject. We'll get into more about the low-dose CT scan program, what that's all about, how the treatments work, how have they worked. We'll do it all with Dr. Littles. When we return, you're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Dr. J. Fred Little's joining us in studio this morning, radiation oncologist. We're going to highlight the low-dose CT scan program. Now, Dr. Little's, explain exactly what is the low-dose CT scan program.
Thank you, David. A major study came out in 2011. It was the National Lung Screening Test, sponsored and organized by the National Cancer Institute, published in the New England Journal of Medicine, which is a marquee journal within our field. It showed that people who are at high risk for lung cancer, which are people who've smoked for 30-pack years and are age 55 to 74, there's a reduction in their lung cancer mortality, which means they would live longer if they were screened for lung cancer. 20% longer, or a 20% reduction in death from lung cancer if they would undergo lung cancer screening. So one age 55 to 74, a 30-pack history of cigarette smoking, which is in essence is smoking 1 pack a day for 30 years, or 2 packs a day for 15 years, or 1.5 packs per day for 20 years. So again, a 30-pack history of cigarette smoking is roughly 30 packs a day. 1 pack a day for 30 years, or 2 packs a day for 15 years, and age 55 to 74, relatively good health. They're appropriate for lung cancer screening, and if you are in that high-risk category, there's an excellent chance that low-dose lung cancer screening would save your life. And the numbers to remember are quite simple. Patients who have lung cancer, who undergo lung cancer screening and are detected with lung cancer, have a 70% chance of being cured of that lung cancer. And that's a lot higher than if they weren't screened and the cancer was found later. 70% chance of cure with the lung cancer screening.
What are the treatments that are working these days? Because we talk on this program so often about we've come so far from 20 years ago versus, where we are now. Even 5 years ago, we've made a lot of advancements. So what are the treatments that are working in 2019?
Well, Dave, thank you. Just like everything else, just like cars are a lot more advanced than they were 20, 30 years ago, communication is a lot more advanced than it was 20, 30 years ago. Military force, military techniques are a lot more advanced than they were 20 to 30 years ago. And medicine is a lot more advanced than it was 20 to 30 years ago. So as studies are being produced and put out, the data for those studies are changing very rapidly because our treatment is much different now than it was 20 to 30 years ago. The best treatment for early-stage lung cancer still is surgery. But there's a subset of patients with early-stage lung cancer that aren't candidates for surgery. And the new technique that came out the last 15 to 20 years, and we now have it available at Morgantown, at Mon, is stereotactic body radiation therapy, which is giving a very, very high dose of radiation in 3 to 5 fractions, because we used to give 20 to 30 fractions, but now we can give, in certain cases, just 3 to 5 fractions, give a much higher dose with an 80 to 90% cure rate. And some experts believe it's very, very close to what you can get with surgery. So patients before who had unresectable lung cancer because of what we call comorbidities, which is emphysema or bad hearts, had to have really what was called conventional radiation, which was 20 to 30 radiation treatments, and the cure rate was about 30 to 40%. Now they can have a much higher dose of radiation per day, 3 to 5 fractions, and the cure rate is 80 to 90% over the past 10, 20 years. And I want to also say that breast cancer is very similar. So treatment of breast cancer has advanced so that the predictions 30 years ago about the number of women that would die of breast cancer in 2019 was exaggerated by 40,000 women because of screening and newer techniques. So hopefully the number of people that died in 2019 of lung cancer is 150,000. And we predict that number will probably be stable over the next 10, 20 years, hopefully that number will be 40 to 50,000 lower 10, 20 years from now because of what we're talking about now, which is screening and the newer techniques of treatment, which have been developed over the past 5 to 10 years. So we're making progress on all fronts, and that's a part of the excitement of being in medicine.
What is SBRT?
Yes, is what we just talked about, stereotactic body radiation therapy. Once again, high-dose radiation, and we classically give 700 to 1,200 rads or centigrade, and we used to give 180 to 200. So the doses is much higher. The technique is much more localized because the technical aspects of the field had developed just like the technical aspects of the military in targeting has developed.
That's what I was going to ask next. The higher doses are because you're able to pinpoint exactly the target you are going for now, or pretty close to it.
In a much better way than we were 10, 20 years ago. You know, just like targeting in the military is much better now than it was 10, 20 years ago.
We're talking to Dr. Jed. We were talking about Jed during the break, and that was still in the break. J. Fred Jenkins joining me in studio, radiation oncologist. Where is your practice? What's the name of it?
Yes, I'm at the Mon Cancer Center, Mon Health System, just off J.D. Anderson Drive.
We will continue our conversation on the other side of our final commercial break. You listen to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our Mon Health guests, call now, 304-296-0041.
Talking to Dr. J. Fred Littles, radiation oncologist, joining us in studio this morning. Who should come see you? Who needs to get a lung cancer screening?
Definitely. The major study published in 2011 was very clear. The high-risk group, age 55 to 74, with a 30-pack history of cigarette smoking, i.e. 1 pack a day for 30 years or 2 packs a day for 15 years. The low-dose CT takes about 30 minutes, very inexpensive, and has a 70% chance to pick up cancers in an early stage. And if those cancers are picked up in the early stage, the cure rate is approximately 70%. So Mr. or Mrs. X, a high risk has those high risk category for lung cancer, fits that category. He or she decides to come in for a low dose CT. Number one, if he or she has lung cancer, there's a 70% chance that lung cancer will be picked up in an early stage. If he or she is in that 70% and picked up in an early stage, they have a 70% chance, roughly, of being cured of that lung cancer. So I love the number 70%. It's a good number for me and much higher than we had 10, 20 years ago.
What do you hear from people that prevents them or, keeps them away from getting these screenings if they're in these categories? What do they tell you? This is the reason why I didn't come get these screenings all these years, Doc.
Fearful, didn't realize that it was as affordable as it is, didn't really know about it. That's why we're doing this now. Or the nihilistic review of you have to die with something. And my dad would sort of agree with the latter, that you had to die with something. But one of the things he also said was, you don't want to do anything that would hurry up your time, because you're not going to leave here until your time is up, but you don't want to do anything to hurry up your time. So for me, if you a high risk for lung cancer based on your smoking history, and you're not getting your low dose CT, you're doing something to hurry up your time. We've been talking, because we certainly can help you.
We've been talking mainly about smokers, and we know, I think we've been told since, or at least I was, since it's very little, don't even start smoking. But in 2019, and we've talked about it on this show, vaping is catching on. That's the trendy thing to do. What are you seeing from a medical standpoint here as far as the effects vaping can have on you?
Yeah, some people look at vaping as being better than cigarettes and a way to quit smoking cigarettes. That actually is correct, but it's an unsafe way to quit smoking cigarettes. it is an unsafe way to quit smoking cigarettes, mainly because what vaping is not regulated by the FDA. So these for-profit companies are putting things in the liquids that add flavor, not really regulating the nicotine percentage. So they'll tell you it's X percentage of nicotine, and it could be doubled or triple that. They'll tell you that we'll just put a small amount of quote-unquote ingredients to have flavor. What they don't tell you is that the ingredients contain lead, nickel, and zinc. And to have these metals going in our young adults' bodies right into the blood system through the lungs, long-term sequelae of that, short-term side effects of that, no way to regulate that. There are kids that are going in the emergency room now from lung injuries from vaping, nicotine toxicities, all these things that are unknown. So vaping should be considered an unsafe way to stop smoking. The safest way and the best way actually to stop smoking is just cold turkey. And we have to remember nothing great in life is ever easy. But there are nicotine gum, nicotine patches, different pills, even hypnosis. There are a plethora of ways to quit smoking that are safe. E-cigarettes is not a safe way to quit smoking. E-cigarettes is not a safe way to quit smoking.
Got about a minute left. If someone wants to set up an appointment to get one of the low-dose CT scans, wants to set up an appointment to meet with you, how can they do that?
Great question. We would want them to go through their physician or healthcare provider, and they will do the screening and the smoking cessation consultation to ensure that you qualify. And if you do, the number for the department is 304-285-2220. Medicare covers low-dose CT screening, and so do most insurance, if you qualify.
Dr. J. Fred Littles, thank you for stopping by this morning. Always a pleasure. Have a great Christmas. Spoil those grandkids.
Thank you very much. I'll try.
Coming up, we've got Fox News, local news, and the talk of the town. It's on the way next on the Voice of Morgantown, WAJR.